This is Richard and Moshe from the AMS Medical and Rehabilitation Center. Today, we're going to talk to you about tennis elbow. Moshe, what is tennis elbow?
Well, tennis elbow is defined as an overuse injury of the common extensor tendon. Common extensor tendon is a group of tendon that sits around this area of the elbow. People that use it either once with forceful activity or repetitive activity may start to develop pain in here. The initial stage of the problem, it used to define as a tendinitis. Overall, the body have a lot of problem to fix this area because the blood supply is pretty low to this area, and therefore this condition can last for a long time. Now, there are a few symptoms of it. Can you talk about it a bit, Richard?
Sure. So some of the symptoms of tennis elbow that you might have been feeling is pain with gripping. Anytime you would grip, you're going to get pain over here. Or it could be pain when you lift up the hand up in the air like this. It will cause pain here. Working on the computer with the mouse, eventually a lot of pain over here. Moshe, can you give us some tips on what to do when someone thinks they have tennis elbow?
Well, definitely. As you said, if someone feel pain in the lateral side of the elbow, the outer part with gripping, what I recommend to do is if it's in the first day and it's very, very painful, try to reduce activity for a few days, even ice 10-15 minutes for 3 or 4 times a day. Reduce the level of activity, don't stop activity, keep on doing your activities, but in a reduced way, or try to find a way where it doesn't cause so much pain. The second thing that we can use is a brace. This is specifically a brace of a brand called Find, a very good brace. This brace the design of the brace, you put it around the painful area and it's spread the compression. Either than the compression be on one point, you feel compression all over, which reduces the pain. And the third thing and the most important thing is we want to demonstrate some exercise that can help you reduce the pain a lot. This is the exercise developed by Brian Mulligan. You can Google it up at Brian Mulligan, not the golfer or the jazz musician. Brian Mulligan, the physiotherapist, which developed tons of technique for self-treatment and also for clinician. And this is the one that we are going to demonstrate right now. Okay, so now what I'm going to show you is how to do the exercise. This exercise is designed to reduce your pain. The first thing that we have to do is identify which movement is causing us the most pain. It might be one of the two, either extension, or what we call extension, or dorsiflexion of the wrist, which means to take the wrist up, to take the palm up. This can produce a lot of pain in here. Or the second one is gripping. Choose which one of the two is causing you the most pain, and this is the movement that we are going to practice. Now, all you need for this exercise is a wall, which is pretty simple. So what are you doing? You're standing next to the wall, your upper arm leaning against the wall, while your elbow is bent. Now you're trying to reproduce the movement that caused you pain. For this example, let's say extension. Now it's painful. What you're doing next is with the other arm, you try to push the elbow area just below the elbow to the outer direction, what we call lateral glide in a professional way. Okay, so we are doing this glide. While we are doing this, we try to do this movement. For your amazement, in many of the cases, you won't feel any pain while you're doing it with gliding. If you still feel pain while doing it, you can try two things. Firstly, to try and push harder or easier, or change a bit the direction of the push, but it's very important to keep it lateral to that direction. Second thing, you can play with the angle of the elbow, which is always very effective in playing with the level of pain. So you try to do it. The dose of this exercise, you try to do 10 repetitions. If it's not painful, it must be pain-free. That's very, very important in this exercise. After 10 repetitions, you can rest, and what you can do is try to do this movement again. In many cases, you'll feel that the pain reduced, and in this case, this exercise is good for you. Continue on doing it. I would recommend to do it between 3 and 5 times a day for a few days. If the pain is reduced, keep on doing it. If you don't feel improvement, then I would definitely recommend to consider a physiotherapist. Enjoyed our video?
Please like and subscribe to our channel.
Thanks for watching.